Hi, my name is Colleen Ariola. I'm the Senior Vice President for Patient Care Services here at the Parker Jewish Institute. I am also the Director of Nursing of Record, and I oversee the clinical operations of the facility, which include the nursing department, rehabilitation, therapeutic recreation, and clinical nutrition, and some other initiatives that we have at the Parker Institute that are in place for your well-being and to enrich the lives of others. I'm here today to talk to you about medication management for the adult. And as we know, as we age, our bodies start to change. And some of these changes we can see and feel, and some of them we cannot. This includes some of the aches and pains that linger, or just pain on simple movement, such as walking or getting in and out of a chair, in and out of a bed. We may notice that we become a little slower. We may experience a little bit more pain than we're used to. For example, our bodies may change in how it responds to absorbs medications. Now, medications, although it is a necessary requirement in our plans of care, medications, no matter what age we are, have potential side effects and could have negative consequences if we're not careful on how we manage them for ourselves. And in fact, according to the FDA Medication Guide for Seniors, changes in the digestive system can affect how fast medications enter the bloodstream and also how slow they exit your bloodstream. A change in the body weight of someone can also affect the amount of medication you need to take, and that will be up to your physician. It can also affect how long it stays in your body. The circulation system may slow down, which affects how fast drugs get into the liver and how fast they get into the kidneys, and in turn, how fast they leave the liver and how fast they leave the kidneys. This could affect also the way a drug breaks down and is removed from the body. And as a result, medicines that stay in the body too long can cause some severe side effects. Therefore, your doctor must always titrate the doses properly and monitor ongoingly just to ensure that you have safe dosaging in your system. Because of these changes in our body as we age, there is also a higher risk of drug interactions in the older adult. Most older adults, approximately 48% of them, take at least one medication, and many older adults take 3 or more medications each day. Older adults comprise approximately 13% of the U.S. population, but account for 34% of all prescription medications used and 30% of all over-the-counter medications that are used. Medication management for adults, we have some important facts that we'd like to share with you. Seniors use more medication prescriptions, over-the-counter medication supplements than any other age group in the United States. Older adults often use multiple medications, increasing the risk of drug interactions and the potential for those side effects that we talked about earlier. Your liver and kidneys may not work as well as when you were younger. Decreased function can affect how these medications therefore work in your body, how they are absorbed, how they are broken down, and how they are removed from the body. Medicines may stay in the body longer and cause side effects if dosages are not properly adjusted. Age-related changes such as weight loss, decreased body fluid, increased fatty tissue can also alter the way drugs are distributed in the body and are concentrated in the body. Another tip, another concern, increased sensitivity to medications is more common in older adults. Impaired memory and hearing and vision may also make it difficult for you to understand and remember instructions, especially for those with complicated regimens. Many older adults also face declining grip strength, mobility, and memory lapses, all of which can affect the ability to take medication as prescribed. Older adults tend to receive prescriptions from different healthcare professionals, making it difficult to track medicines and identify drug interactions that might be harmful in dosing and harmful in ineffectiveness. Chronic conditions such as diabetes, high blood pressure, and arthritis are more common in older adults and often require a complex medication regimen. Older adults may not follow medication plans because of forgetfulness, side effects, a perception that medication isn't working, or its cost. Not following medication instructions is called non-adherence, and non-adherence is not safe. The good news is, though, many of these risks or challenges can be prevented if you are informed about safe medication, appropriate medication use, and how to get the most from the medications itself. So I want to share with you some tips on preventing some problems. First, learn about your health condition and medicines. Talk to your healthcare providers. Read trustworthy websites and join support groups. Secondly, maintain a medication list with you. Maintain the list of the names of the medications, including the over-the-counter medications, the names of the supplements, the names of any herbal remedies. You want to know who prescribed each medication. You want to know the purpose of each medication and the symptoms it should treat. You want to know how often, at what dose, you should be taking each of the medications. You want to know when refills are due. You want to make sure that your refills are filled on time. Update the list when you take something new and if a medication is stopped or changed. Your provider should review with you your medications so you're only taking those that you need. You want to discuss any allergies or problems that you've had with these medications with your provider. Do not stop taking the prescriptions without checking first with that provider. Third, you want to read the drug fact labels, including the package inserts or the patient medicine information leaflets that the pharmacy gives to you. These leaflets will tell you what the medicine is used for, how to take the medication, how often you should take it, and at what dosage. The side effects and allergy reactions are listed. Included are the warnings on what you should take with the medication or possibly not to take with the medication, and when to stop taking the medication per your physician. Use one pharmacy so your pharmacist can monitor your medication and check for drug interactions. Safely store your medications. Check expiration dates. Keep medications in the bottle and the tube that they came in so that the dosage and the directions are at your hand. Keep medicines up and away from children. Never share your medications or take other people's medications. You want to contact your provider if you have any problems with your medication. You want to identify a patient navigator. Ask your primary care physician to act as a navigator for the healthcare system so one person and one practice can ensure that your conditions and treatment regimens are tracked. Medicare's Medication Therapy Management Program is a helpful area to help fulfill these professionals' roles. I'd like to talk to you now about aging, alcohol, and prescriptions. Taking these all together definitely pose a health risk. Drinking alcohol when you are taking medication that is prescribed is a health risk for many older adults. Aging bodies work more slowly to clear both medication and alcohol from the system, which makes seniors more sensitive to the effects of both. Many prescriptions may interact with alcohol and give potentially dangerous effects. Prescription medications may also not work for the intended when combined with alcohol. They may not work at all, in fact, or they may become even harmful or even toxic. If you have certain health conditions or take certain medications, you may need to drink less or not at all. Ask your healthcare professional for advice. I would also like to share with you a few other tips. Managing medications can be one of the most challenging tasks for aging adults and their caregivers. It is a complex process, and oftentimes medications can change. It is critical that older adults only take the prescribed medications that they are given, exactly how they have been prescribed, and confirm with their physician and their pharmacist that there are no potential dangerous side effects or interactions to be anticipated. Senior communities have also resources to help residents manage these medication needs. Medication management is especially important for patients with multiple healthcare diseases and illnesses. Taking numerous medications is known as polypharmacy, and this is particularly common among older adults due to the prevalence of multiple medical issues that they have. In order to avoid possible medication complications, please follow the tips I'm about to outline. Make sure you set yourself reminders of when to take your medications and you consistently take them at those times. You would probably want to pre-sort pills into daily reminder boxes or other types of medication dispensers. You want to schedule your doctor appointments timely and keep a planner to make sure that you attend them. You want to make sure you know which medications to take together and which ones not. You need to know if you should take medication with food or with liquids, and with certain medications, and or to avoid those. Usually medications require you to take them on a full stomach. However, that is not always true. When taking multiple medications, you should be sure of what you need to eat or drink prior to or after taking that medication. Be sure to know it is okay to take multiple medications at the same time, or if they need to be spread out over the course of a day. You also want to watch for side effects. This is especially important when you start to take a new medication or change your medication routine. Pay close attention to any signs of dizziness, loss of sleep, feelings of weakness, upset stomach, or pain. If you should experience any, please contact your medical professional as soon as possible. You also want to dispose of old medications. Medications have expiration dates. You want to pay close attention to these because taking expired medications can cause serious side effects. Dispose of these drugs and consult with your physician about getting a refill prescription if it is still necessary. Promoting compliance with drug therapy. Many pharmacological pain management options exist for you. However, physiological changes in the aging body and coexisting health conditions can present a challenge to the elderly. Compliance with drug therapy can pose a challenge. Many elderly adults mistakenly think that they should take analgesics only when pain becomes unbearable. Some fear that they will become addicted to them. I emphasize the importance of taking your pain medication to keep you ahead of the pain rather than waiting for the pain to become unbearable. Some older adults may avoid pain medication because of constipation and other adverse effects. A fear of constipation stops you from taking your medication as needed. Please call your physician to be educated about dietary changes such as drinking more fluids and/or eating fiber-rich foods. In closing, I'd just like to share with you a couple of more tips. Please always take your medication at the same time. Always call your provider for advice when you have questions. Reach out to your pharmacist who can help re-educate you on some of the things that we talked about today. And you may also watch this video again at your leisure. Please include your family or your caregivers in some of these discussions with your provider. That second ear is always helpful in keeping you safe and healthy. Thank you.